Mabuhay! Magandang araw mga ka-advocacy! Ako po muli si Itchy, and today I am honored to walk you through a comprehensive evaluation framework specifically crafted for advocacy, communication, and social mobilization, or ACSM. It is for all of these programs related to what I call the SLAY ACSM. Yes, you heard it right! SLAY, because when programs are served with intention, strategy, and compassion, they don't just work, they slay. And we're grounding in this real-world case, the fabulous and life-changing work of Love Yourself Inc. PH here sa ating bansa, which is the leading advocacy organization for the LGBTQIA+ community. Tara, sama ka, chikahan tayo! First, ACSM programs are powerful, but it is complex. So why we need SLAY ACSM? It's not enough to measure how many people were reached, but we also need to ask, did they feel empowered? Did behaviors change? Or did the systems do adapt? This framework is designed to capture all of that and more, specifically and especially now as HIV cases continue to rise in the Philippines, particularly among the MSM and trans communities, where we must evaluate not just the impact, but the quality, inclusivity, and sustainability. For our communication and mobilization strategy will be useful and how it works. Now, let's define what is SLAY ACSM. SLAY ACSM stands for the 5 critical areas that define a successful advocacy, communication, and social mobilization program. S stands for strategy and structure. L stands for leadership and advocacy. A stands for activation and awareness. Y stands for yield and outcomes. And AC stands for analytics and continuous quality. Each component is rooted in solid theoretical frameworks and foundations like the IMB model, RE-AIM framework, and the community-based monitoring and evaluation principles. Together, they help us assess the programs holistically, and from messaging and partnership, the policy that has been influenced in data use were cohesive. The first pillar is the strategy and structure. It is guided by information, motivation, behavioral skills model, or IMB. This means that we ask, first, are we providing accurate and relevant information? Second, are we motivating the target audience in a way that resonates with their context and live realities? And third, are we equipping them with the skills to act, like how to use a self-test kit or how to access PrEP? In Love Yourself's case, the Test MNL campaign slayed this. Why? Because the messaging was sex-positive, youth-friendly, and empowering. They didn't just raise awareness, but they do inspire with action. Next is leadership and advocacy. ACSM programs are only as strong as the leaders who champions them. And then the policies they seek to influence comes after. This includes multi-sectoral partnerships, youth and PLHIV representation, policy advocacy that pushes for gender-affirming healthcare and anti-stigma laws. Love Yourself doesn't just provide services, they do shape the nation's conversation. From working with DOH, LGUs, and even private sector's organization, they advocate for systematic change, not just for short-term fixes. The third part of the framework is the activation and awareness. This is the heart of the communication, based on communication for change theory. And this looks like how campaigns are designed, whether they are challenge stigma or misinformation, and if they truly connect with the community. Love Yourself is a master of this. They use bold slogans like U is equals to you and TikTok-ready visuals and trans-exclusive storytelling that make HIV education not just informative but affirming and beautiful. That's how you activate awareness with impact. The next part of the framework is this fourth part. Let's talk about yield and outcomes. Using the REAIM framework, a gold standard in public health evaluation, we ask the following. How many people are reaching and who are they? What is the program's effectiveness in changing behavior or health status? It is being adopted by local partners and institutions? And are we delivering with fidelity? And can this be sustained over time? In 2023 alone, Love Yourself served almost 10,000 in testing and testing preps and ART while maintaining at almost 92% of viral suppression rate among all of its clients. And that is the yielding that we can trust. And finally, we assess analytics and continuous quality. It is part of the monitoring and evaluation, and it isn't just about forms and figures. It's about learning and adapting. This means that we are looking at first, do we have a real-time dashboards and data systems? Do we gather feedback from people whom we serve? And third, are we making program changes based on those insights? Love Yourself regularly evolves based on our user feedback. For example, Love Yourself shifted towards self-testing kits and chatbot support during the pandemic. And this is a testament of being adaptive, communicative-centered, and having a good approach. Now let's talk about the application of the framework to Love Yourself. When we apply SLAY ACSM to Love Yourself, we see an organization that doesn't just tick boxes, but we redefine them. They model that what it means to be strategic, community-led, and stigma-aware. We also have outcome-driven and data-savvy. From bold campaigns to their quiet acts of care, it shows that how ACSM works that can be both useful, academic, and deeply human. To conclude, SLAY ACSM offers a structured yet flexible tool to evaluate what really matters. It is in advocacy and communication work. It bridges theory and practice, letting us assess not just if it is a program who works, but how and why it works. If we want HIV responses that are ethical, inclusive, and transformative, we must learn to evaluate it with heart, with rigor, and also with pride. So let's accept the challenge, and this is our call as our future monitoring and evaluation specialists, program managers, and advocates. Let ACSM program slay. Be strategic, loud, adaptive, and data-driven. Evaluate not just to prove, but to improve. Because when we love our data and love our communities, we build programs that truly loves back. And that's how the SLAY framework works. Once again, please check these references for this presentation. SLAY ACSM is not just a catchy acronym, it is a robust tool that evaluates behavioral, organizational, and communication lenses. It has group findings with a real-world relevance and continuous learning as we promote equity, participation, and sustainability in the LGBTQIA+ and HIV-focused advocacy. Mabuhay again! Ako po si Ichi and see you on the next Chikahan!